Hi everyone, in this video I would explain about the collection, function and clinical significance of cerebrospinal fluid. What is cerebrospinal fluid? Cerebrospinal fluid is a clear, colorless body fluid found within the tissue that surrounds the brain and the spinal cord. CSF is produced by ependymal cells of choroid plexus into ventricles. From the ventricles flow into subarachnoid space and surround the brain and enters the spinal cord through central canal. In normal healthy adults, the rate of formation of CSF is 100 to 250 ml per 24 hours. Functions of the CSF. It helps to protect the brain and spinal cord from injury. It carries nutrients to the brain and spinal cord and removes waste products. It is important to maintain a constant pressure inside the head and around the spinal cord. Composition of normal CSF. Color and appearance clear, colorless, no coagulum or deposit. Pressure 60 to 150 mm CSF. Specific gravity 1.006 to 1.007. Cells 0 to 4 mononuclear cells per C. pH 7.3 anaerobically. Protein content 10 to 45 mg per 100 ml. Glucose 45 to 100 mg per 100 ml. Chloride 700 to 760 mg per 100 ml as NaCl. Urea 20 to 40 mg per 100 ml. Calcium 5.5 to 6 mg per 100 ml. Collection of CSF. The CSF is collected by lumbar puncture. What is lumbar puncture? A lumbar puncture is a test used to diagnose certain health conditions. It is performed in your lower neck in the lumbar region. During a lumbar region, a needle is inserted into the space between two lumbar bones to remove a sample of cerebrospinal fluid. Inject dye or radioactive substance for imaging, myelography or cysternography. Lumbar puncture image. How to collect lumbar puncture? Uses: to identify infections like encephalitis, meningitis, syphilis; to identify bleeding like subarachnoid hemorrhage; to identify cancer or tumors in brain and spinal cord; to identify inflammations like Guillain-Barré syndrome, multiple sclerosis. Side effects: severe lower back pain, headache, slight bleeding at the site. Biochemical changes in CSF. Estimation of glucose in CSF. This can be done by any of the usual blood glucose method. Clinical significance. Normal value varies from 50 to 80 mg per 100 ml. CSF glucose level is slightly lower than the blood glucose. Decrease in CSF glucose. The most important pathological change in coccal meningitis. Due to meningococci, staphylococci, pneumococci, glucose often disappears completely in CSF and it may be totally absent. In tuberculous meningitis, glucose content may be reduced, but it is rarely absent completely. Usually, it varies from 10 to 40 mg per 100 ml. In viral meningitis, the glucose concentration is often normal, but it is occasionally as low as 20 mg. Increase in CSF glucose. Small increases are found in some cases of encephalitis, poliomyelitis, and cerebral abscess, and values between 150 to 180 mg have been found in some cases, but this is a little diagnostic value. Estimation of chloride in CSF. Determination of chloride in CSF. It is possible to titrate most CSF directly with an appropriate silver nitrate solution using potassium dichromate as an indicator. When CSF is titrated with mercuric nitrate, and ionized mercury chloride is formed. When all the chloride ions are used up, the excess mercuric ions will react with indicator diphenyl carbazone to give a purple color complex which gives the endpoint. Clinical significance. Normal value. The chloride content of normal CSF, whether lumbar cisternal, lies between 700 to 760 mg NaCl 100 ml. Decrease in CSF chloride. A decrease in CSF chloride is seen in meningitis ranging between 700 to 600 mg NaCl. The reduction is generally more marked in tubercular meningitis as compared to coccal meningitis. Increase in CSF chloride. An increase is sometimes found in hyperchloremic acidosis in chronic renal failure. Estimation of CSF protein. Determination of CSF protein is normally done by turbidimetric method, but some of the colorimetric method For estimation of protein have also been used methodology, turbidimetric method, reagents, sulfosalicylic acid 3% solution, proteinometer standards 1 set. Procedure: 1 ml of CS fluid is mixed with 3 ml of sulfosalicylic acid reagent in a small test tube. Mix and allow to stand for 5 minutes. The turbidity developed is compared against the tubes of proteinometer set. Normal value: protein content of normal number CSF ranges between 15 to 45 mg per 100 ml. Protein content is almost entirely albumin with a small amount of globulin. Increases of CSF protein and increases in the total protein in the commonest abnormality seen. The protein in such cases is a mixture of albumin and globulin. Increases in globulin can be roughly ascertained by qualitative test. Quantitative analysis can be done by electrophoresis and immunological method. Thank you for watching this video.